Could your embarrassing, annoying, or painful symptoms coming from your back or your bottom be coming from your pelvic floor? Take this simple quiz that I'm going to go over with you. It's just 10 statements and answer yes or no. Here we go.
I sometimes have pain in the genital perineum, pubic or bladder area, or pain with urination that exceeds a 3 on a scale of 1 to 10, with 10 being the worst.
I can remember falling onto my tailbone, lower back, or buttocks, even in childhood.
I sometimes experience one or more of the following urinary symptoms: accidental loss of urine, feeling unable to completely empty my bladder, having to void within a few minutes of a previous void, pain or burning with urination, difficulty starting or frequent stopping of urine stream.
I often or occasionally have to get up to urinate 2 or more times at night.
I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out.
I have a history of pain in my low back, hip, groin, or tailbone, or have had sciatica.
I sometimes experience one or more of the following bowel symptoms: loss of bowel control, feeling unable to completely empty my bowels, straining or pain with bowel movement, difficulty initiating a bowel movement.
I sometimes experience pain or discomfort with sexual activity or intercourse.
Sexual activity increases one or more of my other symptoms.
Prolonged sitting increases my symptoms. You just took the Kozain pelvic dysfunction screen. If you answered yes to 3 or more of those statements, it's 91% likely that you have a pelvic floor issue. The best person for you to reach out to for help is a pelvic floor physical therapist. And I want to tell you why. Because a lot of times pelvic floor issues are missed, and especially depending on which statements you answered yes to, it might be missed by well-intentioned, well-meaning physicians, primary care doctors, OBGYNs, even your midwife. Um, so back issues, if you're primarily having, say, back pain or tailbone pain, and you're not having any changes in your bowel or bladder function, or it's not affecting your sexual function, your provider might miss that you actually have a pelvic floor issue. So that's why it's best to talk to somebody that treats this type of these types of issues day in and day out. So I encourage you to right now just Google pelvic floor physical therapist in my area and see who you can reach out to for some consultation, for answering your questions and finding out more. I'm happy to help you as well. Our contact information is listed below. Thank you.